Rodney Davis is a 54-year-old male who reported to the ER with angina that was unrelieved by nitroglycerin. We hooked him up to a 12-lead EKG, and he had ST elevation, so they took him to the cath lab and did a cardiac cath and put stents in. They went in through his right femoral artery, and he has a dressing on it that is clean and dry. We held manual pressure for 15 minutes, and it stopped bleeding. He has a central venous catheter and an indwelling Foley catheter, and he has IV fluids going, normal saline. He has a history of hypertension, coronary artery disease with angina and asthma. He has allergies to penicillin, peanuts, and sulfa, and we also found out that he has an allergy to shellfish because they gave him contrast dye during the cardiac cath, and after he got to the unit, he started showing symptoms of an allergic reaction to the contrast dye. He reported itching over his chest and his arms, and then started having trouble breathing. So we put him on a non-rebreather mask and gave him epinephrine. So he has a PRN order for that epinephrine, and that seemed to help his symptoms. He's still on 3 liters nasal cannula at 99%. His pulse, his last vitals, his pulse was 74, respirations 12, and BP 112/72. He is regular sinus rhythm with premature ventricular contractions, and he has also, his last labs that came in, his potassium was down to 3.2.